my name is Jamie Corsa. Today I'm going to be demonstrating irrigating a wound as well as obtaining a wound culture and doing a wet to dry dressing as well as measuring. So first, right now I'm outside my patient's room in the supply area. I have gathered my supplies, and first I need to read off the healthcare provider orders. It is 0900 right now, and it says daily dressing of wound with a wet to dry dressing, change dressing as needed, as well as obtain a specimen for wound culture. And I also double check just with the patient, Shirley Cost 54, date of birth 5/14/64. So now I am going to go into my patient's room, knocking, as well as closing the door to provide privacy and doing hand hygiene. Okay, hello Shirley, how are you today? Good, good, okay. So first what I want to do here is I just want to double check your wristband here to make sure everything adds up with the provider orders, okay? So making sure Shirley Cost 54, Shirley Cost, date of birth 5/14/64. Okay, good. And allergy is codeine. We don't have to worry about that today. Okay, Shirley, so today what I'm going to do is we're going to go ahead and change the dressing on your wound, as well as I'm going to clean it out. So I'm going to irrigate it with some solution, and then I will obtain a wound culture, okay? So what I'm going to have you do is that the patient would help. I'm going to have you flip over in the prone position on your stomach. And if the patient could not help out, you would want to get help from another nurse. Okay, and then always making sure that the patient's head is towards the side so they can breathe. As well as you want to make sure you're obtaining as much privacy as you can, so we'll just put it right there. So you might see some buttocks, but we're good. Okay, so after, since I have touched the patient, I will perform hand hygiene again, as well as don gloves. Okay, Shirley, are you feeling any pain? Okay, on a scale of 1 to 10, what would you rate that pain? Okay, about a 5. Okay, and if the patient, before you do this, is in pain, you would medicate as needed or as it says in the chart. Okay, so now that I did that, I am going to open up my dressing tray here. And I just want to grab this bag right here. I just want to set it up right next to the patient so we can just dispose of everything in this bag. There we go. Okay, so first what we want to do is we want to take off the dressing. I've seen that it is soiled, so what I want to do is just remove that. If the tape doesn't come off very easily, you can take an adhesive remover and help with that. But it is coming off pretty well here. And it goes right into the bag here. Okay. So now I'm just kind of looking at the wound, looking at the color, the size, just kind of looking. So what I'm going to do, since I did touch that, I am going to take off my gloves and don new gloves before I irrigate. So what I want to do here is, I don't have, my solution. Put it over here, which I would have with me on the table. Apologies. Okay, so what I would do is I would take my 30 milliliter syringe here, and I would attach the angiocath to it, and then with my solution I would pull back 30 milliliters. Okay, and before that I am going to just kind of press around. I want to make sure that I'm pressing around for edema, also looking for any pustules to see if anything is in there before I irrigate, so I can just get everything that I can. So I'm going to put the kidney basin right here so the drainage can kind of drain into that. And I want to start at the superior end of the wound here. And I just want to press down, and I want to go from side to side. And you'll kind of be going from like top to bottom of the wound. And you want to do that until the it's draining clear, so it gets all that color out. I see that it is draining clear now, so I will take this away and dispose of it, as well as this would go straight into the sharps container for purpose of the video. I'm just gonna put it right there. Okay, so now that I've done that, I am going to, I want to take a dry gauze here, and I just want to kind of pat around, making sure that I'm not touching the wound. I just want to dry it up. I also forgot to mention that when I'm irrigating, I do want to hold the syringe about 2 inches above the wound while I'm doing that. Then I will throw that away. Okay, now that I've done that, I am going to, before I change my gloves here again, I am going to measure this in millimeters here. Here we go. From side, not touching the wound. So I'm getting about 65 by 70. Okay. Now I'm going to obtain a culture. I would then again change my gloves. So I want to open this here. Grab this. Okay. So now what I want to do is to obtain a culture, you want to get right here on this side. So you want to go down, not touching the sides, and you just want to kind of go back and forth, making sure that you're not touching any of the slough. And then once you get that, you want to put it into this, and you don't want to touch the side of it while putting it in. Isn't that going in? Oh, it's got a top. I am so sorry. Touching the side. There we go. And then you want to put a label on this, and since you want to make sure everything matches up, the name, date of birth, and then I also want to do the time, date, and my initials. So it is 0900 11/6 and my initials. Want to make sure you put this on here. Around there, and then you will put this in a biohazard bag and get it down to the lab as soon as possible by a CNA. Do not refrigerate it. Place that over here. Okay, so now that I have obtained a culture, I am now going to dress the wound. So what I want to do is I can place this on my table because the inside of it is not touching it. So first I am going to pour some solution, sterile solution, into here. And what I want to do is change my gloves again and perform hand hygiene. So what I want to do is make sure that this is in solution, and I kind of want to wring it out, but I want to spread this out and get it kind of all bundled up, right, like that. Okay. So what I'm going to do now is I'm going to put it in the wound. I do not want to touch the outside edges of that. So I'm going to place it, and then I'm going to grab another damp gauze, and if you have to wring it out, you can. And I want to place it right over top. Okay. Then I'm going to grab my extra padding right here, and I want to hold that, and you don't want to put too much pressure because you don't want to hurt them. And now I'm going to grab my tape. That tape's not the best, we'll use this. So what I want to do is I want to make sure that I'm getting about a 1/2 inch to an inch past the edges of the thing. Maybe, there we go. Ooh. Okay. I want to get the ends here. That's kind of comfortable. Okay, now that I have done that, I am going to go ahead and Shirley, we're going to turn you over now. We are all done changing that dressing. And she would help turn herself over, or we could also get another nurse to help. Okay, Shirley. So we are all done attaining that culture and changing that dressing. Is there anything that I can get you, or you needed to use the restroom? No? Okay. Want to make sure her call light is right there. And she is in a comfortable position. There we go. Okay, I would then leave the patient's room, perform hand hygiene, as well as document the pain, how the patient handled it, the color, the odor, if there was any measurement, and all that, and then I'm done.